It's a skin cancer remedy invented in the 1930s that's becoming more popular today.
News 13's Jay Siltzer found out firsthand about Mohs surgery for this special health alert.
There's somewhat of a skin cancer epidemic, you could call it, going on.
Under my TV makeup is a 3-inch scar.
It's been 6 weeks.
It's not a long time.
Especially considering it resulted from cancer surgery to remove basal cell carcinoma from my forehead that looked relatively harmless.
I think your case highlights actually the difficulty of knowing what's going on, because no one would expect you to know that this spot that looks like a scar, I mean, it looks just like a scar, is actually a skin cancer.
For something that didn't look too bad, is this about as bad as you've seen?
Yeah, this is the kind of almost nightmare scenario you have.
Cancer beneath the skin 7 times larger than the initial spot, penetrating almost to the skull. It required several attempts in one day to remove the cancer, while preserving as much good tissue as possible through Mohs surgery.
By doing the Mohs surgery, we are able to look at 99% of the exterior margins of the tumor, as well as the base of the tumor, and to know with, in some cases, 98-99% certainty that you are tumor-free after the procedure.
You leave here with a big sense of relief that it's done, and you followed up with it. If you don't, you know what the repercussions are.
Danny LeSure realizes he could easily be dead from 3 recent bouts with skin cancer, likely stemming from playing outdoors as a kid with no sunscreen. The first problem appeared on his back.
I had melanoma surgery following real close after that, and that's been about 4 years ago. After that, I had squamous cell on this side, and then the basal cell on this side. And I've had the Mohs surgery up here twice.
The scar is good texture, color match is good.
For Danny, there is little visible sign of the procedure because of reconstructive techniques. But for me, suturing up nearly a $half size hole proved more difficult.
What we were able to do is take a triangle here and a triangle here, like darts on clothes, and bring the edges together to form a straight line.
20+ stitches, and several weeks later, injections are still needed to reduce swelling and blend the color. It's a scenario that's happening to more and more people from too much exposure to UV rays.
I mean, 50, 60-year-olds now are absolutely the norm, and unfortunately 40-year-olds becoming much more the norm now as well.
What's worse, more and more patients in their 20s and 30s are also being seen for skin cancer that doctors say could likely have been prevented by using sunscreen, wearing protective clothing, and avoiding tanning beds. Jay Siltzer, News 13.